who is on, we'll start with her. So just so you know, if they haven't gotten on before then, you don't have to take the mask off just yet, but just so you know that okay.
So it's fine.
In any case, Lily, why don't you get
Yeah,
started?
of course. Yes, thank you, Roland, and good afternoon, everyone. It's such a pleasure to be here with all of you and see your smiley faces in these difficult times of the pandemic. But I'm an optimist, and I see that the ER are getting less people, ER rooms. That's what my colleagues in hospitals tells me, my friends, that everything is looking a little bit better. So I want to feel confident that eventually we'll be able to see each other again personally and not have to see each other via the computer and all of these Zoom calls, which are beneficial, but it's not the same as a human interaction. So thank you for being here. And I want to thank our presenting sponsor. It's Victoria Nursing and Rehabilitation. Mr. Richard Stacy, he's a sweetheart. He wasn't able to be here today, but I know that Raul Elias Reyes, the compliance officer and risk manager for Victoria Nursing, is here. I know he's going to be very brief in his comments, but we want to thank him. He's going to say a few words on behalf of Mr. Stacy. Raul?
Hi, thank you. Hi, how are you? I hope everyone's staying safe. So first of all, thank you. Can everyone hear me?
Yes.
Okay. Thank you for the invitation. I'm sure it has been a challenge to put this meeting together. So compliments to everyone. It's not easy. We're living new times now. So as you all know, the COVID-19 has changed the way we do business. It has changed the way we do meetings and how we interact with each other. And this is a perfect example right now. We've all heard stories about the impact of COVID-19 in nursing homes. And as healthcare workers, our main goal is to keep our residents safe and provide family members assurances that we are doing so. So since the beginning of the pandemic, we are diligently following the CDC guidelines, Centers for Disease Control, the Florida Department of Health, and the Agency for Healthcare Administration. There are several resources, several tools that have been shared in order to be able to prevent and control the spread of COVID-19. So what are we doing as nursing homes, okay, to prevent the further spread of COVID-19? Many things, okay? Since the very beginning, we put in practice administrative policies and procedures, okay, in order to face this new outbreak. One of the first things that we started doing back in late February, beginning of March, was symptom and temperature screening for every employee that came into the facility and visited as well. Also, as they went into the facility, we reinforced the physical distancing, the hand hygiene, and universal infection control precautions. As time went on, later in mid-March, new guidances came out where visitor restrictions were put in place. And this is still they are still in place. So unfortunately, family members cannot come into the facility, and just healthcare workers that are in direct contact with the residents can come into the facility. Education, monitoring, screening of residents, screening of healthcare personnel, and any other visitor coming into the facility is being done daily. Like I said, on March 13, visitor restrictions were put in place, and also there was a mandate that group activities and group dining within nursing homes were stopped. So we did that as well.
Thank you.
We are doing testing to every employee in the facility every 15 days, and this is a mandate in Florida, okay? Visitors coming into the facility as well are being tested. Education is being provided. Infection control guidances are being provided. We are working closely with CDC again, and all the agencies, Florida Department of Health and the Agency for Healthcare Administration, following new guidances. And new guidances are going to be coming in every week. So we are keeping close communication. One of the important things that we're doing is keeping close communication with our residents and their family members. You know, this is a big impact that it has in residents. So we are using all our available resources, telecommunication, iPads, smartphones, smart TVs, in order for them to be in contact with them. And one of the questions that we get from family members right now is, how soon can we visit? Unfortunately, we don't have an answer for that yet. And the way things are going, I think this will take a little bit of time. But as we go on, I know that people will get desperate to come to see their loved ones and will be able to visit. but this will take some time, okay? Because we're still concerned for our residents, our well-being, and our safety. So hopefully soon we can open up our doors again and have everyone come into the facility. But meanwhile, we're just keeping them safe.
Thank you so much, and say hello, send our regards to Mr. Stacy, and thank him for
will
being the
definitely.
title sponsor today. Thank you so much, Raul, for all your support. Our presenting sponsors, Vitas Healthcare, Gold sponsors, Florida Community Care and Residential Plaza Blue Lagoon, our media partner, Univision, with Claudia Pui always, and Ponemos Group. And with us also is Josefina Carbone, and I always like to acknowledge her because she first Cuban-American who held a very top position at Washington, D.C., as Undersecretary of Health and Human Services under President Bush. And we have Commissioner Steve Bobo, who said he's just going to say hello for a couple of minutes because I know he has to leave. So thank you, Commissioner, for joining us today.
Thank you, Lillian, and I just wanted to say hello to all of you. Sadly, we don't get to go to monthly luncheons and see each other at events, but I wanted just to remind you, the critical role that all of you have been playing and are going to continue to play. As you see, we're trying to come up with the best remedies as far as getting businesses opened again. And I've been very vocal in opposition to a lot of the moves that have, in essence, started closing down small businesses once again. And really, the only way this thing could work, where residents, I think, have a lot of confidence in what we're doing, is a collaboration. We need some guidance from the business community on what's the best way to open, how do they keep their employees and their customers safe, and kind of let business kind of guide this decision. I don't want to have government write the prescription that sometimes leads to a little bit of chaos. So I just wanted to put that out there. Again, I appreciate all the work that you guys do, not just now, always in our community. But we're going to look a lot to the chambers to help guide, especially for those small businesses, guys. That look, if we, people that are ordering merchandise have expended a lot of money to get their businesses in shape to take customers, and then government comes and closes it, that could be catastrophic. We already know businesses that may never reopen again, and that's a travesty apart from the entire travesty that we're living now. So that's all I really wanted to do, Lillian. I appreciate again the time.
Thank you.
Virtual hug to all of you. Okay?
Yes, thank you, Commissioner Bobo. Thanks so much. And now also, it's my pleasure to introduce Elaine Bloom. What can I say about Elaine Bloom? She's a pioneer. She was in the House of Representatives. I know that she's the one who created the law for the community care for the elderly program, the Florida International Banking Act. She's done so much, and I love her. They've been a member of the South Florida Hispanic Chamber for so many, many years, and they took care of my dad in his last months of life, and I'm very appreciative. So Elaine, a few words, because I needed to have you here because you're a pioneer. You're a lady that we all look up to, and I see you as family.
Well, thank you, Lillian. I feel the same way. I hope Mary Mayu is with us already.
Yes, she is.
She is an amazing woman. Mary Mayu is Florida's Secretary of the Agency for Healthcare Administration, and one of my proud moments in the legislature was actually creating that agency. And I can personally attest to the fact that she's doing an excellent job in these very difficult times. As the CEO of 5 nonprofit skilled nursing homes, I've been on those Florida Healthcare Association conference calls with her every single week for the past 5 months. Mary Mayu is responsible for about 31% of Florida's budget, as she administers Florida's Medicaid program for about 4 million Floridians and regulates thousands of healthcare facilities. She certifies and regulates 40 different types of healthcare providers, including hospitals, nursing homes, adult living facilities, and home health agencies. Mary Mayu came to Florida in the beginning of 2019 after serving as Maine's Commissioner of Health and Human Services. Prior to that, she was a vice president of the Maine Hospital Association for 11 years and lobbied state government on behalf of healthcare in general. After leaving her position with the state of Maine, she ran for governor of that state, so she knows all sides of state government. We're very fortunate to have her leadership helping us through our current crisis, and I'm indeed honored to introduce Secretary Mary Mayu to the South Florida Hispanic Chamber of Commerce today. Thank you.
Thank you, Elaine.
Thank you, Elaine.
Thank you, Elaine. Thank you for that wonderful introduction. I truly appreciate that. And it is my pleasure to be with all of you today. You know, I'm asked often, what is it about Florida's response that has been so successful? And I know it's a multifaceted approach, but honestly, when I boil it down, it's about relationships. It's about getting out from behind the desks in Tallahassee and engaging with leaders around the state, healthcare leaders, county administrators, county health officials. We know that our job at the state level is to support the regional response in a crisis. And this pandemic has put all of that to the test. But I am so grateful that I've had the honor and privilege of working with providers throughout the state, but certainly I have been on calls every other day with hospital leaders, county health officials in Miami-Dade, Broward, and Palm Beach throughout this pandemic. And it's that partnership, that level of engagement that has helped to inform policy decision-making, that the governor's had at his fingertips, not only data, but the perspective of where the priorities have needed to be. And I want to just very quickly, I know we've got a lot of speakers, so let me just say from the very beginning, the governor has had a laser beam focus on protecting our elderly. We've known that this virus was going to put at risk our most vulnerable, our elderly, individuals with underlying medical conditions, and that individuals living in our nursing homes and our assisted living facilities were most at risk because those residential settings are just more vulnerable to rapid transmission. So knowing that, obviously, we were also focused on making sure that our hospitals, that our healthcare system had the capacity to respond. But knowing that vulnerability, that informed decisive action early on, again, working with the Florida Healthcare Association, working with the assisted living associations to make sure that we were, every day, as you know, we've learned something new about this virus, every single day. And it was important that we didn't have false expectations about what our long-term care providers were prepared to do. And I say that because these are amazing providers with frontline direct care staff that have done just incredible work supporting our frail elderly. But it was clear that the infection control requirements to combat this deadly virus exceeded standard practice. When you think about the early days and the conversations around N95 masks, negative pressure rooms, and the challenges that our hospitals had in getting access to PPE with supply chains that were well established with our hospitals, it meant that our nursing homes and our assisted living facilities were that much more challenged to get access to that level of PPE. So we took immediate steps, the screening requirements of staff and vendors, the restriction that we put into place that every day continues to break my heart, the visitor restrictions. We certainly believe it was the right thing to do, remains the right thing to do, but we understand that the consequences to physical and mental health when you're separated from your loved ones. We really got on the phone with hospitals and said, you can't discharge back to a nursing home, even though that COVID positive individual may no longer require hospital level of care, if we don't have confidence that the nursing home is prepared and able to take that resident back and adhere to infection control standards. So unlike other parts of the country, where nursing homes were required to readmit a COVID positive resident, we said no. And much like the nursing home calls that Elaine referred to, we had daily calls with the hospitals, and every single day I heard hospitals saying, we need to discharge these individuals, and I would say no. We can't, because the risk is too great. We mandated that anyone being discharged from a nursing home or assisted living facility regardless of symptoms, if they were in the hospital for something other than COVID, they had to be tested before being discharged back to a nursing home or assisted living facility. As you know, one of our greatest efforts has been to create dedicated COVID isolation facilities providing skilled nursing facility level of care. We began in March trying to identify and work with facilities, and this was at a time where, rightfully so, facilities were very reluctant to take on that ask. We worked with facilities. Dolphin Point, Clear Choice was our first facility in Jacksonville. We have 22 dedicated facilities around the state that are there to provide a step down from hospital level of care for COVID positive individuals who no longer require that care. No one should be in a hospital bed any longer than necessary. So that's offered the ability to do appropriate and timely discharges so individuals can be in the right level of care. We know that for some nursing homes, when we think about the average age of our nursing homes in Florida, and even more so in Southeast Florida, it's around 40 years old. These are buildings that both because of their air systems, because of their capacity, some of them are at 95% capacity, they have semi-private rooms, very difficult to isolate. So our dedicated facilities have allowed some of these nursing homes and ALFs to be able to transfer their residents who are COVID positive to the dedicated facilities. You also know that we have mandated testing, which was described earlier, every 2 weeks. Now, what I'm so proud of is that Governor DeSantis said we're going to provide the state-sponsored resources for that testing. I was concerned about the financial burden on our long-term care providers to cover the costs associated with some of that testing, or just the staff time if they had to travel to get access to testing. So very pleased that we were able to get a contract with one vendor, and that we were able to distribute self-administered testing kits, because for so long we've been doing testing that required a nurse or a CNA to administer the test. And those have been distributed to all our nursing homes and ALFs. So over 200,000 employees and other contracted staff being tested every 2 weeks to, as we've said all along, we've tried to stand guard at our nursing homes to prevent that virus from getting in, but also working across the continuum. So we talk a lot about our nursing homes and our assisted living facilities. I just want to reinforce, well, we have 4,000 facilities across the state. We have over 150,000 individuals in our nursing homes and long-term care facilities. We have, my goodness, over 35,000 in Southeast Florida who are in nursing homes and assisted living facilities. But we have 4.5 million individuals in Florida over the age of 65, many of whom require services and supports in their homes. And again, I'm incredibly proud of the home health agencies and so many of the providers that have risen to the challenge to continue to provide services in the home so that our elderly did not risk exposure out in the community. We sometimes lose sight of, and I know in Southeast Florida, the level of effort to deliver meals when you had to close down the adult day programs, and what a vital resource those adult day programs are, but to reduce the risk of those congregate settings. Again, Southeast Florida has done just a tremendous job of looking at ways to support all of our elderly and across the continuum of our healthcare system to meet those needs. You know, that's been my focus here. How do we make sure that we don't have any gaps in people being able to access critical healthcare services? Telehealth, telemonitoring has been a huge part of that. But we've taken a comprehensive look. We have monitored the CDC guidance every single day, working to provide education and resources to our nursing homes and assisted living facilities. But truly, it has been a regional partnership. I am grateful for all of the work that has occurred, the level of engagement from our hospitals, from our nursing homes, from our assisted living facilities, but really the nurses, the CNAs, the dietitians, the individuals who are cleaning the rooms, the amazing dedication and courage, 24/7, people are, getting bombarded with the media, with social media, and yet we have the commitment and dedication of staff in our nursing homes and in our assisted living facilities that we should all take the time to just express our appreciation to them for everything that they've done to care for and to meet the needs of some of our most vulnerable individuals. So I'm grateful for the opportunity to join you. I'm honored to have had the opportunity to work with providers throughout the state, but certainly with incredible focus on Miami-Dade, Broward, and Palm Beach, and all of the amazing work that's occurred over the last many months. I know people are exhausted, they're stressed, they're strained, but every day they're rising to the challenge. And I look forward to continuing our partnership to support Florida's response to this unprecedented pandemic. Lillian, thank you so much for the opportunity to join. And Roland, thank you.
Oh, Secretary, I think we're especially sensitive to your time constraints right now with everything's going on. So can't tell you how much we appreciate this. And really identifying the fact that you're kind of responsible for a third of the state budget is, on top of everything else, seems incredibly chaotic. But thank you very much. And on a interesting note, I'm actually in Maine right now. I'm in Penobscot Bay, yeah, with my family. So
You're not in Bayside, are you?
no. I'm driving up Connecticut. It was in Portland, Connecticut, Camden. I mean, what a beautiful state.
Wow. It's a small world.
Yeah, no, I can tell why you spent a lot of time here. Anyway, so I do want to quickly at least mention the rest of our panelists as we're going to go to Councilman Luis Collazo next, but we have Councilman Luis Collazo, who's manager of Palm Breeze ALF, Dr. Ortiz, who's a medical director for Vitas Healthcare. We also have Annette Requena, who's the associate general manager of Vitas, Tatiana Pita, who's the vice president of care management of Florida Community Care, and finally Sandra Puchada from Community Outreach, who does community outreach for Residential Plaza Blue Lagoon. And you mentioned a word that actually, in talking to the rest of the panelists, that they mentioned, which was collaboration. And so it's an interesting dynamic. And frankly, I would think now more than ever, Secretary, it's needed just because of the profundity of the issues we're having. Louis, do you want to talk a little bit about the kind of things going on in your neck of the woods and the impact on you? And by the way, one last thing, he's one of the people that you used the word collaboration, Secretary, when we were speaking.
Thank you, Rolando, and thank you, Lillian, for really bringing into focus something that is very, very timely. And I think a lot of it, from what Raul said and what Secretary Mayhew said, from the beginning of this pandemic, we knew that the most vulnerable were the people and the Floridians that we cared for in assisted living and nursing homes. So I agree with the Secretary spot on. I think, very early in March, we partnered, and I'm going to keep on using that word, and I'm going to use the word collaboration because it's very unique. I don't think that there's ever been a time in history other than in hurricanes where we view the relationship with our regulators more as a partnership now more than ever. Because this is not something that is adversarial. This is something that we're fighting together on the front lines with every day. And I think somebody attested to it. I think it's Miss Elaine Bloom who said, it's not, or Mr. Elias, every day or every week we're on these calls with the agency, really in a collaborative effort to deal with something that's novel, something that's new, something that we've never confronted. And the reality is that whether you're a nursing home operator or a hospital provider or an assisted living provider, we weren't necessarily very well equipped to deal with a pandemic of this scale. And the fact is that we have had to rely heavily on our Department of Health, our Office of Emergency Management, ACA for guidance, CDC. And the reality is that our future, the only thing that I can tell you about our future is that it's ever changing. So even up till yesterday, we're getting guidance and getting recommendations from our partner agencies on how we need to respond. And this is uniquely impactful to assisted living facilities. And again, I'm going to go back and talk about specifically assisted living facilities, because unlike hospitals, maybe unlike certain nursing homes, assisted living facilities are very unique, not just in South Florida, but throughout the state of Florida. Assisted living facility, at least here in South Florida, most of them are not facilities at all. They're small little single family residential homes nestled in neighborhoods. They house, and actually most of them are minority owned businesses, and they house and provide services usually to 6, sometimes 8 or 10 residents in small single family neighborhoods. When you think of these types of buildings, the physical plant is not one that's conducive to isolation rooms, and Secretary Mayhew referenced it earlier. You know, the social distancing, that's not what happens inside these types of facilities. They're actually designed quite the opposite. They're designed to have people congregate together, and actually they form these little social hubs. So really this pandemic and the guidance that we've received from our community partners like the CDC, ACA, and Department of Health has really turned our profession on its head and said, hey, you have to rethink how you do all of this. And I would say very, very early on, I'm very proud, and we only hear the horrible things, right? You only hear these negative things that come to light on the media. You only hear about the negative outcomes of an outbreak somewhere. But the reality is that I'm very proud of many providers who have very quickly adopted and implemented changes to protect the life and well-being of some of Florida's most seniors. And I think that cannot be underscored more, because again, sometimes we get caught up in, you know, an outbreak and the number of deaths, and sometimes we fail to emphasize the amazing job that some of these providers have done to really protect the life of their most vulnerable. Now, I highlighted some of these smaller facilities. The reality is that under that same catch-all, there's one provider here. I think the largest assisted living facility in the state of Florida, Residential Plaza, is represented on this call. You're talking about not just small providers, but large system operators having to take on new policies and procedures on a fly relatively quickly and adapt to that. It has been an immense undertaking, which has created some of the operational challenges that I wanted to kind of touch on, and what I think is going to be future considerations, at least so when we start working with our agency partners and our policymakers, which are going to have to deal with this issue. And some of the speakers have alluded to this already. You know, we've incurred a lot of cost. Some of the cost is not something that we were prepared to capture when we were preparing our budgets back in January or December, or sometimes for the fiscal year for ACA, much more before us. That's placed a real burden on a lot of our operators. And the reality is that staffing has also become an issue. So the Florida Assisted Living Association and many of the associations are starting to couch those issues with our partner agencies, and in particular, you know, our Medicaid providers are making the Secretary very aware of what these operational challenges are. And we've seen a very positive response from the state, because they have supported us in some of these efforts to start testing our staff. And I think the Secretary alluded to it. You know, we on a monthly basis get delivered test kits to our facilities, and with those test kits we have to test our staff every 2 weeks. That's been a huge relief, because one of the things that I've realized during this pandemic and controlling outbreaks is access to testing and timely results is the most effective tool that we can have as providers that help us protect the lives of those that we care for. So by ensuring that we have those test kits and having access to timely testing has been a huge benefit to our providers. Future considerations that we have to take on, and I think that we need to start having the dialogue now, is this operating how we used to operate and operating with the budgets that we used to operate with are no longer feasible. We know some providers are barely treading water and are barely able to support their operations with the increased staffing and the increased use of PPE and all the other budgetary increases. So I think moving forward, the state associations and provider networks, along with our regulatory agencies, are going to have to continue to embrace that partnership where we continue to look at revenue streams and look at making sure that we have enough money to sustain operations at these new normal standards, right? Or at these new standards for infection control and staffing that we need to keep our residents safe. One last thing that I wanted to touch on, and I think Secretary Mayhew said it, and I don't know if the commissioner is still on the call, but what we've seen here in Miami-Dade County to really support our seniors and the role that local government has taken and county government has taken to assist our most frail is really a job that I've never seen anywhere else. And I really wanted to commend our county officials for making sure that we're able to take care of our constituents. And I wanted to thank him while he was on the call, because that was something huge very early on that was deployed at the county level. And I think we need to continue that work. I just think we need to do it at the local municipal level, and looking forward to partnering with our county providers, our county officials, to make sure that we're continuing to roll that out here in the municipal level as well. So thank you so much, Lillian. Thank you, Rolando. What a very good presentation, a very timely topic, and it's been an honor to be on this panel, and look forward to answering any questions that anybody may have.
Thank you, Louis.
Thank you,
Thank you.
Louis.
Roland, unmute. Unmute there.
I'm super impressed during the workday. You're dealing with responsibilities as the manager of an ALF, and then all that free time you have, you're counseling right maybe legs. So whatever and I imagine you got to get some sleep. So whatever time management skills you have, if you could pass them along to me, I would really appreciate that.
All that credit goes to my wife and my kids, and a very supportive family. Let me leave it at that, and God, obviously.
Women power.
So thank you. Yeah.
No, but I want to thank you for your service. I mean, in addition to Secretary Mayhew, I mean, that's a lot to ask of somebody to be doing, to have all that on their plate. So thank you very much.
No, thank you.
With that, you're welcome. Dr. Ortiz and Annette, if you could tell me exactly how Vitas Healthcare is tackling this issue, please.
Unmute. Unmute.
Hello, can you hear me?
Okay, now we can hear you. You were
Okay, all right, thank you. So as the national leader in hospice and palliative care, Vitas Healthcare has really taken an aggressive approach to meeting the needs not only of our patients, but our employees that we have, and our patients that we have in the ALFs and nursing homes in our community. Okay, and internally, we are taking all the measures to support our staff and to also ensure that our staff is healthy and able to make visits in the ALFs and the nursing homes, which is so important. We have instituted what we call in Vitas the Health Check app, okay, that is required for all employees to enter before they begin working and before they're able to make any visits out in the ALFs or the nursing homes or the community. It monitors and trends their temperature. It asks specific questions regarding COVID and symptoms, okay? That's one piece. We also have, Vitas is also doing what we call a real-time infection control management team and tool. We're using this to address employees who have exhibited any symptoms to ensure that they self-quarantine, and we're always using CDC guidelines and contact tracing. Vitas internally has, we require all our employees to use appropriate PPE at all times. And we've been able to respond to the individual testing needs of our partners because we are testing our employees at Vitas locations. So I just wanted to let you know what we're doing internally as a company to meet the needs of our nursing homes and ALFs. Some of the things that we're doing for our patients in the community, in the ALFs and nursing homes, has a lot to do with bridging the communication gaps that we now see that's so common and unfortunate during COVID. We're able to do visits via telehealth. That has been a real success. Our nurses and doctors are actively FaceTiming loved ones when they get to the facility, so they're able to make that contact that's so important, and it's so needed by the residents of the nursing homes and ALFs. We've been very successful and able to provide music therapy via FaceTime or Zoom to our patients. Our psychosocial team has helped to coordinate these sessions, and it has really brought a lot of joy to our patients that we've been able to see. So that's one thing that we're really, really proud of. We also are taking Zoom and in-call bereavement support groups. We continue to do that in the community. We have about 30, and we also have Zoom and call-in caregiver support groups. So that continues. Dr. Ortiz will probably talk a little bit now about our higher levels of care that we continue to provide and offer to our patients who are experiencing symptoms that are hard to control with what we call continuous care and IPU and contract beds in different hospitals. So I'll let Dr. Ortiz talk about that for a little bit. Oh, you're on mute. And no. Dr. Ortiz?
Can't hear you. Maybe we should go. Hello? So Marie? Dr. Ortiz?
Yeah, she might be.
She has audio problems. Maybe we'll come back to her later, Roland?
Yeah, no, I think, yeah.
I think she's going to coming to my
The world
office.
of technology.
There you go. It's right there. All right, we got lucky. All right.
So, thank you for having us. I'm having technical difficulties. And if you guys noticed from the beginning of the call, I had somebody in my office, and this is so important, this mask and social isolation, 6 feet apart. This is something that we're practicing in Vitas, as you see right now, in live. So apart from the things that Annette has mentioned, and Annette, if you're going to stay 6 feet away, I'm going to take this off. So
I think it's important that you're doing that, considering the secretary is watching you right now. So.
So as mentioned by other people on the panel, Mr. Collazo and Mr. Reyes, if I were to rate who in the community had the fastest response to this, it has to be nursing homes and facilities. Immediately what you saw was that they hermetically sealed. They wouldn't allow anybody in without monitoring temperatures and asking questions. And we in Vitas, and Annette explained that a healthcare app was created specifically for our staff to be able to enter their temperature and make sure that our patients and families remain safe. Screening questions became very important. Recent travel, does the patient or family member have positive cases in the home? Is the patient or someone at home having active COVID? So we started to do what Annette alluded to regarding infection control. Now, it's as everybody is speaking, Secretary Mayu, she mentioned that, and again, hermetically sealing was key because that's our most vulnerable population. So as she mentioned that once these folks started to go into the hospitals, then they decided on saying that we're not going to discharge them if they're positive. So one of the things that we in Vitas had to work was educating the physicians that followed those patients. At first, they didn't want to test. So we had to educate them and tell them that we really needed to test these folks to see their positive status change to negative in order to facilitate going back to the facility. So that became very important. And in the middle of that, also, the families weren't allowed to see the patient, so we had to also bridge the communication gap with these folks, which was definitely key in our preparation. So apart from that, we have different levels of care and different places where we go treat our patients. If that patient that was coming from a facility, in our world, it's very important to understand what is the goal of care of the family. If the goal of care is within the spectrum that hospice can provide, we will stay with them in our care. And in that event, if the family confirmed, yes, we want to remain in hospice, we want to go to the hospital because the facility is sending us there. If the care was in the scope of what we could do, we would provide it for the family. So we had plenty of patients that were in contract beds that we were treating with azithromycin, hydroxychloroquine. So we provided the care that was being used with other people that were affected with this illness. People spoke about the impact that could have. Speaking about budgeting and all of this, we had folks that were in contract beds for months, without knowing the impact that would cause, but it was the right thing to do for our patients and families, and that's why we decided to do that. So speaking of the different levels of care, we have a level of care that is called continuous care, that is placing an LPN around the clock to service this patient. And we were able to do that with PUIs and COVID, which had symptoms that were changing very drastically along the day. So those folks had somebody there staffed to take care of them as this occurred. PPE was provided to all our staff that went to these PUIs and positive cases. So we had to manage a supply and demand chain that was a little bit weak, shall we say. We also created, and this is key, so when you have the patient that's in that contract bed that decided that their goal of care, as per patient or family or both, was to remain in hospice, then you have somebody that's occupying a bed and just there, which is the correct thing, as pointed out by the secretary. But then it becomes, where can we provide the care and have them not waiting for the facility to be able to accept? So we created COVID units where we would take these patients from the hospital system and move them here, control their symptoms, and be testing them to await their consecutive negative tests. And we've been very successful at doing that. And you mentioned collaboration and partnership. That's exactly what we created with the hospitals and the facilities. We bridged the communication gap as the patient moved from the hospital to the COVID unit, and have been very successful in taking them back to the facilities. As the secretary mentioned, as the facilities created wings or areas for these folks. So that has been tremendous for us. The speed of initiation of telecare, I believe that has been accelerated all through healthcare. We came up with codes so that our physicians could be able to have a FaceTime visit with our patients. So that is something that's here to stay, and we'll probably continue to do so. And Annette mentioned it, but we are testing our staff, specifically those that will require a negative test in order to go back to facilities, as mentioned previously. So needless to say, this is the first nationwide national disaster. It's not a forest fire in California. It's not a hurricane in Florida. Nobody has been left untouched, and our mission in VITAS has always been to protect the most vulnerable, collaborate with everybody in the community that also serves this population. And if anything, if this crisis has shown us anything, it's the vulnerabilities in healthcare and how it's completely important to transition these folks as soon as possible to hospice in order for them to not have to suffer, and that we can provide the care wherever they're at. Maybe it's a home, maybe it's a nursing home. We will go to where they are at and provide the care. Always following CDC guidelines, always following ACO regulations, which you have to keep up with them because they're constantly changing. But I'd like to take the opportunity to thank everybody involved. The secretary, thank you for guidance. And I think that we're all in the same boat, and it's all about collaboration and partnership for us to move ahead during this time. So cultural change is painful, but with good leadership, we've been able to move around as crisis change and as our vulnerable population is being affected by it. So that's really my end on it. And thank you for letting us be a part of the panel, and sorry for the technical difficulties.
Thank you,
That's
Dr.
the part of the world now, right? So thank you.
Thank you, Dr. Ortiz. I think you handle it about as well as anybody could, just walking over next door. But not everyone has that.
But the DM is neighbor, right?
But yeah, I want to make sure we go right to you, because I know that you have some important stuff to add to the conversation.
Yes, good afternoon. Thank you, South Florida Hispanic Chamber of Commerce. Thank you, Secretary Mayhew, for taking the time from your busy schedule. And my fellow panelists are representing our provider partners. And I think everyone has mentioned the word collaboration. And I think another two key words are really transformation and new mindset. This has forced us to reinvent ourselves, and more than ever, to really work together to serve and preserve our most vulnerable population. So before, I would like to provide a brief overview of what FCC is. I think everybody knows what ACA is, maybe VITAS, but FCC, Florida Community Care, is one of the newest health plans in Florida. We are a long-term care plus plan. We were selected by ACA to provide managed care assistant, medical assistant, and long-term care services to in the Medicaid beneficiaries that are enrolled in the long-term care program. We currently are serving close to 12,000 individuals, Florida Medicaid recipients, throughout the state of Florida, and they reside at different locations. We have members residing at home, ALFs, and nursing homes. So how have we transformed ourselves to again ensure that our population remains safe in whatever living arrangement they have chosen. Again, definitely working with providers. We have acknowledged facilities, but I do want to acknowledge home health agencies. That is very close and dear to my heart. And it's hard for these providers to be every single day in the member's home providing services. We have many home health agencies providing services to COVID-19 positives. That is not an easy task. So again, kudos to all the providers, but I did wanted to acknowledge this provider type. So as part of what we're doing here in Florida Community Care, we are requirements that we have to meet. We have contact requirements. So right now we have increased our frequency of contacts, not for the sake of increasing the contacts, but we want to ensure that any new gaps in care or unmet needs are addressed, especially for these special and high-risk population. We all know that Mayor ordered all the adult daycares and congregate meal sites to be closed back in April, and that put a lot of burden on some of the caregivers and some of the members that was the only way of having access to some socialization and interaction with other human beings. So as part of the process and increasing the contact, it was also assisting these individuals to review and revise their current care plan to put either their contingency plan in place, which may include their national support system, but also identifying other care needs, and those services were added to the care plan or increased to actually address now the inability to attend the adult daycares. We have implemented different mechanisms to identify positive COVID-19 cases within our population or presumptive cases. And when we do so, either through claims data or provider outreach or case managers outreach. Again, these contacts assist us to identify any needs and to put in place or participate in the discharge planning with the hospitals or facilities to ensure that when these individuals return back to the community is safe and will not return back to the hospital or the facility. One of the challenges that we face during this time has been transition across different settings, especially across different facilities, hospitals to nursing homes, hospital to ALF, ALF to nursing home, vice versa. And we have seen a slight change in the natural course of transition, which is usually home, then to ALF, and then to nursing home. Because increase of isolation, or the risk for isolation, and the fear of contracting the disease, some of these members and the family members, they have decided to transfer these enrollees back to home. Not only to ALF back in the community, but we are seeing an increase in the people that are being transitioned into homes. And again, going back to what I was saying, it is critical that we maintain a very close contact with this enrollee in collaboration with the family members to really have in place a safe transition and care plan. One of the things that had mitigated the challenge is really, and Secretary Mayhew talked about that, the implementation of the isolation centers and the order and the mandate that the hospitals must test any COVID positive before being discharged to the facility. So thank you for that to the Governor DeSantis and to Secretary Mayhew. ACA has, again, she mentioned 22 centers across the state, and that has really helped us to ensure that these patients are properly isolated and they have a proper recovery. I want to mention an endeavor that ILS, who is the parent company of FCC, we have assisted state and local governments to address food insecurity. That's another big issue that has arisen. I mean, it was present, but now more than ever due to this pandemic. So I wanted to mention that ILS has delivered over 4 million meals during the last 4 months, serving 45,000 residents in Miami-Dade County. And we are very, very proud of this opportunity. Again, working very closely with providers and the local government. IRS has also provide 3 million shelf-stable meals to 17 food banks across the state. And also, we have provided other emergency meals, 550, almost 600 meals, 600,000 meals to individuals served by not only FCC, but other health plans. So again, and this has generated 275 job opportunities for the community, including warehouse, including packaging and delivery. So again, this has forced us to transform ourselves, not only professionally or from business perspective, also personally. Before we used to have every month great events that the chamber put together. Now, at least we can see each other via Zoom. That has another great opportunity. We have been tapping into technology, not only video conference, telehealth. Part of our case manager's role is assisting these frail individuals to have access to this technology. And in partnering with so many providers, like primary care physicians, that they have using this technology. So again, thank you. And I'm honored and happy to have the opportunity to work together with all the providers to continue serving this population.
Thank you very much, Tatiana. I want to get to Sandra the last, but certainly not least. But you know, Sandra, one of the things I had asked for a for a little outline, and you know, her her first item I thought was really touching, because the point was solutions to reduce loneliness and improve quality of life in the elderly affected by this. Which, like I said, if anybody who has, you know, sick parents, elderly parents, anyone in any of these nursing homes, that's exactly right. I mean, these are really tough, heartbreaking sort of challenges that they have. And Sandra, like I said, I appreciate the people like you that are dealing with it. And with that, please.
Thank you. Hi, thank you, Lily from South Florida Hispanic Chamber of Commerce, for having me on. As you know, I have a beautiful background, but I'm at home recovering myself. So with that said, yes, we have had challenging times. I must say it has been a journey, and we have all, I guess, are in on it and learning from it. So with that, let me say thank you to Elaine Bloom, which has been such a leader in our community, not only now, since day one that I got into this assisted living facility environment. I've heard your name, and I am honored to have you as part of our panel here today, as well as Secretary Mayhew and Luis Collazo, which I am very close to. I see at FALA conferences all the time. He's a very close friend of ours at Residential Plaza, and he's helped us very much. And amongst all the other leaders, Florida Community Care, which is a partner of ours in the long-term care, and just everybody here. So let me be brief. I know we're almost at the end, and I really wanted to touch the solution to reduce loneliness and improve the quality of care for the elderly, whether in an assisted living, in a home environment. First of all, since we all know they're always lonely, and they're always, even if they're at home, they don't have a lot of activities. But one thing that in our facility we've been able to help with is they understand, and they have been so well in helping us help them in this isolation process. We started back in March, as early as March. We shut down, we allowed no visitation. We kept strict rules as the CDC would advise us, and ACA and all the other resources that have assisted us. From the get-go, we isolated them in their rooms, giving them as much information as possible, not allowing them to go into the area where they could eat publicly and converse. We had to take their meals to them in their rooms, and they wouldn't understand. So it was constant communication. And I think that communication was what helped us help them to understand. Because after the TVs and all the issues that were there, they were so fearful that they were all going to get COVID. They didn't even know what COVID was, but they were fearful of getting it. So we started advising them on how to isolate, how to wear their masks from one another in their rooms, and just started educating them daily. It was our task, all of us. We didn't, like our administrator said, Barbara Galindo, we're not in a position right now to have a title. We're not titles anymore. We don't have a specific job specification. We are all here to do what needs to be done for them, not for us. We're no longer a title, we're a body. I remember that at the beginning. And we became bodies to them. Constantly reminding them, constantly going to their rooms, letting them know where they were feeling comfortable. If we needed to adopt the air conditioner, what they were concerned about, what their questions were. It was constant. And we had very little at that time for PPD equipment. We didn't even know what it was. We knew universal precaution, that's about it. And we kept universal precaution as always, but using gloves and masks and shields, and this would even scare them. So we would have to tell them, we're here to protect you, and let them understand that we were there no matter what was going to happen, 24/7 round the clock. And as families started not being able to be in touch with them, it became more difficult. We had to become more close to them. We had to hold their hands, and we have guided them. And I am so thankful to say that today, after months of isolation, they have handled it so well. I can't even handle it as well as they have. They have been great. So what I think would be good for the community, if they have their loved ones at home, they're facing through these challenges. Let them know that, you know, there's other things that they can do. We've implemented a lot of formal reading material in Spanish and English, not about COVID, about everything else, about something that they've liked the topic. We've traveled them around the world. We've brought them information about different places, fun things, crossword puzzles that they can do in their rooms. And then we go and check up on them. We sit with them, virtual contact via smartphone and iPads for them to see their loved ones so they could talk to them. So we've been in that type of contact. And our administrator also once a week has a conference call live with all the families. There's an information number and you could contact that number if you have a concern as a family member, and she will address it on that weekly call. We keep them updated, all our family members, they know exactly what's going on. Our website is fully updated. Every Wednesday, there is a information, like I tell you, hotline number that they can call. She'll address their concerns. So everybody is on together in this. It's a big universal contact with the families, with us, with our staff, testing every 2 weeks, monitoring temperatures, doing all that the CDC has required us since day one. Still no visitations, but things are looking positive in their understanding. And now we're implementing other things, like we have an app that they can contact and do virtual visitations, and we're scheduling those. So in a big question, there's a lot of things that they could do at home, like maybe perhaps reading to them in Spanish if they like Spanish books, 5 minutes of your time, maybe having letters sent to them from family members, contact family members and have them write their nieces and nephews, write them a little note and send it through the mail. Those are all positive things that you can do as they transition this isolation at home or in an assisted living facility. I know that ours are acclimated, they're happy, and they've done an excellent job. And we have been COVID negative for a while now. And I have to take the honor of our administrator, which has implemented so many guidelines, and she's been so strict. And, you know, she's really kept it closed. No exceptions, closed, period. So we've done it, and our families are content. We are doing admissions as they come, as the need in the community is often sometimes from nursing homes or from hospitalizations. They can no longer go back home. There's no family member, and we're taking those, you know, one-on-one admissions depending on the COVID and all the other restrictions. Yes, so that's one of the things. Is it safe to live in an assisted living facility community? Yes, it's as safe as it is in your home. We have done every single precaution to clean the staff. We've hired a cleaning, our housekeeping is around the clock, doesn't stop. So like they do it at home, we do it in an assisted living facility. I'm not gonna say that it is perfect, but it is very close to perfect. So, and what makes a difference? I think what makes a difference is the love that you give them to the elderly. They're in just dire need of just being loved. And if anything we can provide, we sign up for that as a member of Residential Plaza. It's not a position, it's not a job title. If you don't have that heartfelt love and passion for what you do, it doesn't work. That's all I can say.
Beautiful.
Thank you, all of us, for being here today. I know it's an important topic for all of us. I'm honored to have been in this panel of just the best, the very best of each category, I can say. And thank you, Lily, for having me for so many years. And I don't know if there's any questions that you'd like to ask, but I'm open for that. Well,
unfortunately, I think we've gone a little bit over, but Sandra, but thank you very much. It was very, you can tell how passionate you are about what you do. That's wonderful to hear. And frankly, you know, the long-term industry, healthcare industry, it's been beat up over the past few years. I mean, there's been a lot of bad apples.
It has
you
been,
know,
but we've turned it all into positive. That's
yeah.
all I can
No,
say.
no, no, and
The media is always going to cover something negative, something truthful, because you see it on the news and maybe it's not. But you know what? We've kept our ground. We've done what we've needed to do. We've overcome those negative vibes, and we're going to keep it positive, and we're going to hold each other's hand, and community partners are going to be all in with us. And that's all we're thankful for. I can say that I'm thankful. Thank you. That's all I can say.
no, but you're 100% correct. I mean, we as a society, unfortunately, focus on the negative a little too much. And so the people that are putting the day in, day out, you know, organizations providing love to people, you know, who are in the most vulnerable and in the late stages of their lives. I mean, what else do you want other than that, right? And so Sandra, thank you. Dr.
You're
Ortiz,
welcome.
Ed, thank you.
It has been my
Councilman.
pleasure.
No, thank you so much. Tatiana, thank you very much. Obviously, Representative Bloom, I mean, having you here was such a bonus.
Yeah.
Thank you very much. Like I said, it's always wonderful to see that smile that always lights up a room. Thank you very much. And Dr. Reyes, thank you as well too. So, I mean, listen, it's been a great panel. I mean, we could probably spend 2 or 3 hours about what needs to be done next, but I think unfortunately people need to get back to work. But that's something hopefully that we can consider in the future when things settle out a little bit and it's not, you know, triage all the time and we're not in crisis mode 24/7. Hopefully we can do something in the future. We can educate our constituents about what people in your industry are doing. But more than anything, Sid, thank you very much for your time. Thank you for educating our members, and God bless and take care.
Thank you all. And
Thank you
just
so much.
briefly, thank you once again. I'm not going to go over all the names. You all know how much I love you. I mean, I work really close with all of you. And also a big hug to Mr. Richard Stacy for the support to this webinar. Thank you so much. My Vitas people, what can I say? I mean, Betty, Bell, Maria, and Catalina, everyone, I love you. The doctor, you spoke beautifully. And Tatiana, gosh, and Josefina Carbonell and Luis Collazo, you've been amazing. Sandrita, you know, my heart. And Secretary Mayu, it was just great. And rather quickly, next week, we have a nice, interesting webinar. It's presented by Miami-Dade College and our chamber, and it's business, retail, and customer service training in the time of COVID-19. And if you complete this, you will get a certificate. So it's going to be very interesting. We hope to see you. Actually, it's not next week, it's August 6th. So we have a couple of weeks. We don't want to drive you crazy. Like Roland knows I can be very intense, right, Roland? Very intense. People who know me, I can be very intense. No.
Lopez? No.
And it looks, when you look at me, it looks like I'm not doing anything, but my mind is always nonstop. But that's what we're here for, as a Chamber of Commerce, to serve you, to serve our members, and to work together in unity and as a family. And just, we're doing all of this for our community. So thank you all so very much. And then we'll see
Thank you, Lily.
in weeks. Thank you. Thank you, Roland from Maine. Bye.
Thank you,
Thank you,
Lily.
everyone, for participating.
Thank you.
Thank you. Bye. Bye, ladies.